So we got 3 of these Smith & Nephew fast fix in there. I'm putting the last one in, maybe the last one. Hopefully we can get some good compression here. That's what we're after. And we'll see what happens. Once again, concepts, proper preparation. We have to create some bleeding, no blood, no heal. And of course, always be compressing. ABCs. The ABCs of meniscus repair. So I'm pushing on meniscus, pushing it up against the bleeding surface that I created. Saying a little prayer that it works. There we go. Beautiful. Now I cut that suture. This thing cuts as well. There we go. Boom. Okay, good. So once again, there's that mulberry knot that I placed earlier. That was what saved us. The mulberry knot was able to hold the meniscus in place while I tied it down. I might do one more at the posterior hort, and I'm going to convert this mulberry knot into an actual repair suture. That's it. Medial meniscus repair, bucket handle tear. You saw how unstable it was. Saving the meniscus so that we can save this person's knee. Thank you. As mentioned earlier, the patient was an athlete. He wanted to continue to be an athlete, wanted to be able to play cutting, pivoting, deceleration type sports. The knee was unstable. They opted to have surgery. Here are the surgical pictures. These are about 5 months out. This is what I found. Medial side, bucket handle tear, medial meniscus right there, medial meniscus tear, bucket handle tear. That means that just like a bucket handle, the tear flipped and it was on the wrong side of the knee. That's the bucket handle. It needs to be returned back to the medial side. Before it gets pushed back to the medial side, the area where it ripped off has to be prepared. I roughen it up, I create little vascular channels, and then I reduce it. There is your bucket handle. Once again, it looks like a bucket handle. It just flipped to the wrong side, so I'm getting ready to flip it back. As mentioned earlier, the patient characterized I make an attempt to flip it back, flipping it back, but this little stubborn tear did not want to stay in place. I use a little technique to push it back and hold that bucket handle in place as I applied sutures to it. So I applied numerous all inside as well as outside in sutures. Boom, 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 boom. There's that little suture that was holding it in place, which I later removed. And this is a picture of what looks like almost a final repair. Multiple sutures, some of them are all inside, and then some of these are what I call outside in sutures, holding down the bucket handle tear. That was a little stubborn tear that did not want to be reduced, but I was able to get it back, tied it down tightly. Always be compressing and create a nice bleeding surface. Again, there it is in the top, tied down. Next, I turn my attention to the ACL. This is where the ACL is supposed to live. There is no ACL, maybe just a couple of thread-like structures from the remnant ACL. So I make my tunnels, femoral tunnel,